Welcome, I'm Dr. Ara Deuk-Majan, CEO and founder of the Deuk Spine Institute. Our patient here has had neck pain and pain radiating to her shoulders now for 10 years. She's here from California. And we're going to be performing the Deuk laser disc repair. C5-C7 and C6-C7. It's a little too low. That's a little better. That's the best. Let's get an AP. 2, 3, 4, 5, 6, 7. She's got both herniated discs and degenerated discs at C5, 6, C6, 7. That's perfect. Today we're going to be going in and treating her pain that she has, her neck pain. All right, so we're starting to enter the disc at 6, 7. You agree? Let me go ahead and just get an AP view. I'm using an X-ray machine called a fluoroscope, specialized X-ray machine, to actually localize. Very good. All right. So lateral view. Perfect. We're going to advance our needle into the 6-7 disc. So far, so good. We always go to the opposite side of the patient's worst symptoms. So if she has neck pain that radiates into the left arm, we'd start on the right side, as we are today. I'm going to do a discogram. There we go. So there's the dye I just injected into the 6-7 disc. It's already escaping AP. You can see it on the lateral view. We're going to count 2, 3, 4, 5, 6, 7. So why are we doing surgery? Because she's having horrible discogenic neck pain. What does that mean? It means she's having pain emanating from the disc. The disc happens to be the most common cause of neck pain. In the cervical spine, the disc accounts for 90% of chronic neck pain. All right. Let's, any way you can zoom in a little bit? I think you're zoomed out. Maybe you need to bring the collimator in. You should always bring the collimator in, Jordan, without me asking you, just to reduce the amount of radiation exposure to everybody. Any way you can zoom it in a little bit? So the way you do that is you're going to have to bring my side of the machine to you. That's good. There we go. That should be automatic, by the way. Very good. All right. So we still have the shoulders giving us a little obstruction. You are. That's fine. It's an unusual view there, isn't it? Are we really oblique here? Is her head rotated? Can you straighten her out? Let me know when she's straight. There, that's better. Still not perfect, but okay. She's got a pretty collapsed disc here. That said, our goal is to eliminate her pain from the disc, her axial pain, which is her neck pain, as well as her pain radiating into her shoulders and down her arm. So our goal is going to be pain elimination from the disc as well as decompression of the nerve root. The nerve root compression causes arm weakness, numbness, and tingling. Henry, let's show the audience how does a disc injury cause so much pain in the neck and the shoulders, down the arm. Okay, welcome back. So I will say this, this patient, she's from California. She's actually had some procedures already done on her neck. And I won't say any names, of course, but there's a doctor in California who did a foraminotomy. And it didn't work. And she ended up with complications, spinal fluid leak from that procedure. Okay. Took her a long time to recover. So she came to us because she's still symptomatic. The problem is, folks, a foraminotomy will not get rid of neck pain. A foraminotomy can only try to unpinch a nerve from the back. The problem is most nerve pinching is in the front, not the back. The front of the nerve, not the back of the nerve. Okay? That's why we don't do foraminotomies at Deuk Spine, because they don't work. We don't do procedures we know don't work. Other doctors do them because that's all they know how to do, procedures that don't work. It has been the history of spine surgery to do procedures that don't work, unfortunately. And what I mean by work is curative. Get rid of the pain permanently. So doctors, unfortunately today it's gotten far worse for patients, because now the motivation by doctors is not about curing patients' pain, it's about doing what makes the most money for the doctor and the surgery center. Okay? Now we also make money. There's nothing wrong with making money in medicine, but you should always do what's best for the patient while you're making money. And the problem is these other doctors, they do not what's best for the patient, they do what's best for themselves. And the patients are suffering as a result. There is now curative treatment available for pain. Curative, not palliative. All the treatments to date are palliative. They reduce pain temporarily, and then they stop working, no matter what the treatment is. The only exception is the Deuk laser disc repair you're watching now, and a spinal fusion done properly. Those are the only surgeries that I am aware of in the world, and I know all the surgeries that actually cure pain permanently. Every other procedure doesn't. And the problem with spinal fusion is most of them are not done properly, so patients have bad results, and not by us, but by other doctors. When we do spinal fusions, we have great results. This patient also had disc seal, right? Twice, and it didn't work. So this is another disc seal patient. We just saw one on Tuesday. Here's another disc seal patient that failed. So for people out there wondering, does disc seal work? Henry, save this as a disc seal video.
Copy that.
Yeah, we had a lumbar spine patient, and it may have been her, that had disc seal lumbar. So, will you save, Will you save this as a disc seal video that we can put on our website under the disc seal alternative treatments? Remember that ugly picture of that complicated fusion patient? That was supposed to go under not our fusion, but under like the bad fusion stuff, right? The complications?
Yes.
So here's a patient that had disc seal, and I want to have this video earmarked as failed disc seal procedure, you know? Or a patient with disc seal that failed. Yeah, I guess failed disc seal procedure.
Copy that.
Anyway, we're overexposed. Let's get the lighting down. It's too bright.
Yeah, right here. No. Machine, yeah. You.
So for those of you watching, the laser itself, you can see a glass fiber. That's 550. Oh, look at the herniation that just came out. You guys see that? That is one of the herniation fragments. Amazing. Came out of that crack right there. There's actually a bone spur there. People ask me, do you ever get rid of bone spurs? Yes, we do, when necessary. Okay? That was pretty cool. So, that said, this poor woman has had multiple procedures already done, and they have not worked for her. And I believe this procedure is going to work for her. That's the difference between what we do and what other people do, what other doctors do. She had a what?
She had a carpal tunnel procedure recently on her left.
Carpal tunnel? Yeah. I hope that worked for her. It did not? It's sad. There's a lot of bad surgery done out there. I try to go on the social media and make people aware that surgery done by different doctors, you get different results. You really want to get a doctor who has a really good history, a good record of success. There's another herniation right there. You see that? That came out of the foramen, but it's on her right side. So we're going to get both sides fixed today. And right now I'm just kind of going across the back. Huh? She's stimulated? Yeah. Well, that's good. That means we're in the area that's causing her pain and hopefully fixing it for her. That's amazing. Look at the nerve root. You can see it right there. And this is just below the nerve root, right? See the white thing? That's the actual dura on the nerve root in the foramen. All right, we're not going to hurt the nerve root, but this is a bone spur here. So I'm getting rid of this bone spur that's right next to the nerve. People ask me, do you get rid of all the bone spurs? We don't get rid of all the bone spurs. No, we don't. We don't get rid of all the herniation. We get rid of the ones that are causing problems. That's what I tell them. It's the easiest way for me to explain it. Looking good so far. Any questions from our audience?
Yes, we have a question from Gina on YouTube.
Hello, Gina. Welcome to our live stream from Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder. We'll be happy to take your question. That was another herniation that came out.
They asked, is the patient awake like I saw in your last video?
Great question, Gina. No, for the cervical spine, for herniations in the neck, we put the patient asleep. They cannot be awake. Now, in Korea, they'll keep them awake. But, oh yeah, and they're squirming around. The problem is that the Koreans have had a lot of complications with this procedure in the neck because the patients are awake.
So no sedation?
No, sedation, MAC. Supine MAC sedation. Yeah, but the patients are completely awake. That's who I learned the endoscopic technique from.
So you saw the patient sleeping on it?
Oh yeah, they were squirming around the whole time, and they were in pain. And the reason the Koreans kept them awake was they wanted to ask the patient, is your arm pain gone? Is your arm pain gone? In the middle of surgery, is your arm pain gone, right? And so the problem is the patient's having, I mean, if you had a metal pipe stuck in your neck, down to your spine, right past all your stuff, you know, trachea, esophagus, carotid, you would not be thinking about your arm pain. I mean, I can guarantee you're not going to be thinking about your arm pain, right? So, I mean, I thought it was pretty crazy, but that's how they did it. So we do it different. I figured out, well, you don't need the patient awake to see what you're doing and do a good job. You can see pretty well. Anyway, so the patient is asleep, yes.
So is there a lot of locations in Korea to have this operation?
No, there's not a lot of locations in the world. There's only one place you can get this surgery done in Korea,
Oh, okay.
Woodydal Hospital.
I thought it was other institutions.
No. And I don't even know if they're still doing it, to be honest. Because I heard they stopped doing it. They're promoting fusions now. What is that noise? Do you know? Huh?
The machine? You mean the machine?
Yeah.
Yeah, so they were literally...
It's supposed to make that click, click.
Continuing their program.
I'm sorry?
They were literally an endotracheal tube away from continuing their program.
What do you mean? Yeah.
I'm just saying, like, it would ET to general anesthetic if I would have continued their program.
Well, they paralyzed a few patients in Korea, yeah. That's the problem. So they stopped doing it. even though I learned the endoscopic technique from them. They're the pioneers. They had a lot of complications. You know, the guy who developed the lumbar, Dr. Camden in Pittsburgh, he had a lot of complications too. And, he would have all kinds of complications. So,
Koreans didn't do the lumbar as much as they did the
no, the Koreans do a lot of lumbar. Oh my God, yeah, tons. They do far more lumbar than they do cervical. This is all scar tissue from her prior surgery, right around the front of the nerve root. But I feel like we've gotten the nerve decompressed. We've treated the pain source. I'm just about done. I got a few more herniations to remove here, and then we'll be done. Any other questions? See that clicking? I'm not used to hearing that.
No, but it's fine.
No current questions, but we do have a comment from Canes25 on YouTube.
Hi, Canes25.
Say,
Welcome.
uh-oh, more disc steal. Stealing money one disc at a time.
Yeah, more disc steal. You're right. You're absolutely right. It's unfortunate. That's why I try to raise awareness of this situation, so people can know the truth about procedures that don't work. And pretty much procedures you don't see here, we don't do them because they don't work. If they work, we do them. We don't do procedures. We don't do a procedure on somebody when we know there's a far better procedure. This is a big herniation. It's on her right side. And you could see how scarred up it is. It's all white and scarred and stuck together. So I'm trying to cut it in half so I can get it out, because it's too big to remove on its own. Anybody go see Pentatonics in Orlando? Pentatonics. It's a group. It's a band. They sing.
They're a cappella.
Huh?
They're an a cappella group.
A cappella. Uh-huh. I just saw them last night. It was amazing. I didn't stay for the whole show, but I had to be up early this morning for surgery. So I caught the first half, and it was amazing. I figured Luis might have gone. You probably like that, Luis. Pentatonics?
They're nice.
Yeah. They sing all the Christmas songs and a few others. Well, you can see how dense some of these fragments are. They're so calcified that they sink rather than float. So I have to bust them up into little pieces. Otherwise, I can't get them out. See all the calcium on there? The white, the yellow, I mean, on the white?
Yes, we do.
Yeah. So the more calcium the disc fragment gets, the more calcified it gets, the heavier it is, the denser it is, the less it floats out. So I gotta chop it up into little pieces to get it out. Anyway, just about done with this disc. Any questions?
Yes. This next question comes from Randy on YouTube,
Uh-huh.
asking, aside from the obvious financial motivators, what prevents the DPR from being more widely known and used?
Great question. What prevents the DPR or DLDR?
DPR.
The Deuk plasma rhizotomy?
Correct.
Oh, the Deuk plasma rhizotomy is a brand new procedure. We literally just submitted the patents for it a few months ago. So it's yeah, nobody knows about it. I don't know that the DPR is expensive. The DPR is pretty cheap compared to the Deuk laser disc repair. What you're watching right now is expensive. And it's not even that expensive. Fusions, if I were to do a fusion on these discs, it would be a $160,000 bill. This surgery here is going to be less than that. Okay, so this is cheaper than a fusion. The DPR, Deuk plasma rhizotomy, is much cheaper. Yeah. And the DPR, I think, is easier for doctors to do. The DLDR, what you're watching right now, Deuk laser disc repair, this is very hard to do. I just make it look easy. But the most skilled spine surgeons in the world would not be able to do this surgery without extensive training. And I'm the only one that can train them. So basically, what's keeping them from doing this procedure is knowledge, ability. It's not something, I mean, a fusion is easy for me to do compared to this. Fusions, complex spine fusions are the hardest surgeries to do in spine surgery. I mean, there's some complicated fracture dislocations where you got to reduce the fractures and stabilize them with instrumentation and reduction. But those are all easy for me to do compared to this surgery. Learning how to do this surgery is much harder. So there's a learning curve, was what I'm getting at. That's very difficult. It would be like you've never played baseball a day in your life, and I give you a baseball and say, go pitch a major league championship game. Okay, you wouldn't be able to do it. It takes a tremendous amount of skill. You have to do a lot of practice, and you have to be selected. Basically, not anybody can just go pitch a major league baseball game. So you have to be talented, and you have to be practiced to be able to do it. So think about this procedure as sort of like pitching for a major league championship baseball game. You have to be the best of the best to be able to do it. And in spine surgery, you have to be the best of the best to be able to do this. There are 6,000 spine surgeons in the United States. And of those 6,000 spine surgeons, only probably 10 of them could actually do a case like this. And they'd have to be trained for 6 months. So what spine surgeon wants to leave their practice, leave from where they live, come here and do this kind of surgery? Training, and get paid nothing to do it, right? Because when you're training, you don't get paid. So they would have to give up their $1 million a year income, come here and work for free for 6 months to a year to learn this technique. I don't see doctors volunteering to do that. I actually had to take time out of my practice and travel around the world to learn this technology from the Koreans, the Germans. So I sacrificed earnings, I sacrificed time with my family, my kids, and most doctors aren't willing to do that, especially when they're making so much money doing fusions and spinal cord stimulators and pumps, morphine pumps and dilaudid pumps. I mean, it's big business. And remember, with those treatments, patients never get out of pain. So it's recurrent business. You keep getting patients coming back getting procedures, right? So why would these doctors want to stop having patients keep coming back getting more and more treatment for the same problem when they could fix it and not get that patient coming back? See, they're motivated to have the patients keep coming back. And with this type of surgery, people come here, get it done, and it fixes their disc problem. And they're done, right? One and done. So we don't have a lot of repeat business. About 10% of our patients end up having some other problem that we identify after the surgery, and then they come back here and get some treatment. 10%, okay? But with fusions and other procedures, it's 100%. You know, if you're doing a fusion or an artificial disc or pain management procedure, it's 100% chance your patient's coming back to get more procedures. And that's money in the bank, right? Repeat customers. So unfortunately, doctors, surgery centers, venture capitalists, private equity, whatever you want to call it, they're all motivated to have patients keep coming back and getting procedures done because it's rewarding to them financially. Nobody wants to cure patients except we do. Deuk Spine does. Because we see value in being able to cure people. They see value in being able to not cure people. And they're right. There's a lot of money in the business of not curing people's pain, but just treating it temporarily, making them better for a little while. I think it's unethical to not give a patient a cure when you have a cure available, so that they keep coming back. Now that's become our society today. We're a society of what's called programmed obsolescence. Does anybody know what programmed obsolescence is? It basically means the treatment or the product you're buying is programmed to be obsolete within a very short amount of time, so that you have to come and buy another one. Take the iPhone, for example. Look at your iPhones, right? You have to buy an iPhone like every year because the one the year before is now obsolete. AP? Now, not everybody buys an iPhone every year, but maybe every couple of years, right? The point is, you know, the days of making something that lasts for a lifetime are gone. We used to be able to make refrigerators that lasted for 30 years.
Now they last 3.
Now they last a few years and then they're breaking down.
Same with washer and dryers, dishwashers.
And the problem is that the people are paying the price. The public is paying the price. I mean, I don't think anybody wants appliances that break after a few years, that are designed to break after a few years. Do you? Yet they do. And you could say, well, 30 years ago, we used to build appliances that lasted for a lifetime. You'd have the handyman come over and fix it once in a while, like once every 10 years. Cars are the same way. Everything is basically designed and built today to not last. And so when it comes to spine care, treating people with pain, doctors and hospitals are in the same boat. Why fix somebody when you can have them keep coming back, paying you every time to get more treatment that doesn't cure them? And that's where we are. That's not where Deuk Spine is. We want to cure you and never see you again. That's our business model, because we have the ability to do that. We have the desire to do that. We have enough patients, we don't need repeat business. And we feel people appreciate the fact we give them a curative procedure. So when you talk about, you know, why aren't more doctors doing it, it's really about a philosophical, economic, moral difference. And that's really the essence of it. No other reason. If you're not getting the Deuk laser disc repair, you're going to what I say is a morally corrupt provider. Now, I get a lot of criticism for saying things like that, but it's the God's honest truth. Morally compromised. So you make the decision. You want morally compromised doctors, or you want doctors that are trying to cure you so you don't have to keep coming back? Imagine if we found the cure to cancer today, but some pharmaceutical company refused to release it. And instead they gave you something that kills 95% of your cancer, but you have to keep getting it every 3 years. And it costs, what, $100,000 an infusion. That's exactly what the company would do. They would hide the cure from you. That's our society today. That's how we've basically regressed back towards the dark ages of corruption. And frankly, I don't care if you agree with me or not, because you're watching my broadcast, you get exposed to my opinion. And there's always going to be the naysayers, you know? The people that believe, oh, Dr. Deuk's not right. Dr. Deuk doesn't know what he's talking about. Well, trust me, I do. Been all around the world and seen all kinds of things. And I could tell you right now, and when it comes to pain management, a little distraction, a little shoulder pull.
Nikki, you over there?
Let's go.
Thank you.
All right. Shot. I think we may have to put that, hold on guys, relax a second. Let's put the fluid adapter on, see if we can't make it better. So this technology you're watching, this is 17 years old. I've been going to meetings for neurosurgeons around the world, showing them, ready, pull? showing them these results for about 15 years. And, shot? Wow. That's about as far back as I'm going to get. Shot? All right, I can't get any further back. So that's, the back of that disc is pretty dang collapsed. Yeah, the disc seal may have caused some calcification back there. Anyway, so you're not going to get a lot of doctors that want to cure people. And you're not going to get a lot of hospitals and surgery centers that want to cure people's pain. Everyone has come to, I mean, think about it. Think about the marijuana industry alone. Do they want you out of pain? No, because marijuana is now legal for pain, to treat chronic pain. Sure. So think about all the stakeholders, the companies making money off of your misery. And you got to ask yourself, do they really want you out of pain? The marijuana industry does not. Marijuana has become legalized in the United States for one reason: medical purposes, medicinal. That means pain, right? And they're trying to get more treatments and drugs legalized, you know, for pain. So the problem is that there's so much business and money to be made by people staying in pain, keeping people suffering, that you're never going to see doctors want to do this type of procedure that cures people's pain, because they don't want you cured. The only patients that keep coming back to Deuk Spine are the ones that we don't do these procedures on, the ones that we do epidurals, the ones that we do facet rhizotomies, the ones that we do blocks. You know, they're all temporary. But that's what these people want done. They're either not ready for a permanent because we need to see if the shot's going to get rid of their symptoms or not. Or they know they need a permanent treatment, but they don't want it. They don't want to pay for it, right? So, point is, you're not going to find a lot of doctors that want to cure your pain. There's a market for it. Everybody wants a cure, and everybody should get a cure. And that's why we broadcast. We want the world to know that these things are curable. The problem is most doctors don't want to cure you. And we know that because we've been out there talking to them, showing them. I'll give you another example. Look at primary care doctors. There's a piece of herniation right there. Primary care doctors, when I first started 2004, that was 20 years ago, I would go around and show the primary care doctors we could cure back pain. Scope off, guys. And we did it through fusions at the time. I hadn't started doing the laser surgery. I would just fuse people. But I would fuse the right discs, and I would fuse them properly, in good alignment, with good decompression. You know, it's hard to do a good fusion and do it right. It takes a lot of extra time and effort. But if you do a good fusion, you can actually cure people's back pain or neck pain. And I was doing that for years. So I went around to the primary care docs and told them about it, but they wouldn't refer patients. So I asked my colleagues, surgeons, I said, how do you get the primary care docs to refer? And they said they don't want to refer. I said, why not? And the answer was because they're jealous little doctors. They don't like the fact surgeons make more money than them, blah, 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 right? And I believed that for a while. And it seemed logical, right? Made sense. But then I found out the real reason the primary care docs didn't want to refer patients. And it has nothing to do with jealousy. At least I don't think it does. It has more to do with the fact that the patients were coming to the primary care doctors for pills. And the primary care doctors were writing them for Percocets, oxycodones, morphine sulfate. So basically they were drug dealers. And the patients would come in and get a prescription in 5 minutes. And the doctor, that was the easiest $100 they ever made. Because all their other patients, like diabetes patients and high blood pressure patients, those patients were a pain in the ass. I mean, you got to sit there and look at their logs, you got to counsel them, you got to review their meds. They take a lot of time, a lot of effort, and guess what? You get paid the same amount of money as the patient coming in for Percocets. So we've created an entire generation of drug addicts from the 80s, the 90s, the 2000s, even until today. It's still prevalent that doctors just write for pain pills rather than sending the patient for a curative procedure. So the problem is medicine. It is doctors. It is stakeholders, the pharmaceutical companies. And in the case of spine surgery, it's the companies that make the implants. They don't want curative technology out there. They want you getting procedure after procedure. They want a captive, what do you call it? Captive shopper, buyer, whatever. Somebody who keeps coming back. Okay? That's the reality, folks. So stop trying to blame me for developing the greatest surgery for the spine and not covered by insurance, and why don't more doctors do it? Blame yourselves for allowing your doctors and insurance companies to screw you out of a cure. I'm going to put the blame right back where it belongs, on your shoulders. You guys have allowed the healthcare system to screw you over for years without holding them accountable. You yourselves are to blame. Now I'm here telling you about it, so do something about it. Don't expect me to fix it for you, because I can't fix it. I'm one person. I can make you aware of it. From there, it's up to you. There's an old saying, you can lead a horse to water, you can't make him drink. So if you want to fix the system, then you're going to have to fix the system, not me. Don't look to me to do that for you. I know the problems of the system. I've seen them, and they're really stacked against the patients. And it's been going on for years, many, many years. Another herniation, right? And the reason why it's happening, folks, is politicians. Your politicians have not been doing what's right for you. They've been doing what's right for themselves. Where do you think their campaign contributions come from? Come from large corporations that prey on Americans. And the politicians write laws that allow them to prey on you. Those are the politicians that are supposed to be doing what's best for you. Well, they're not. They're not. Time to wake up. Smell the coffee. All right, next question.
This next question comes from Roscoe on YouTube,
Yep. Roscoe, good morning.
asking, have you ever made a serious mistake on a patient?
Have I ever made a serious mistake on a patient? No, I have not. I've been very careful. I'm not your typical surgeon, Roscoe. I just am not. I've seen neurosurgeons make serious mistakes. I saw it in my residency when I was operating with them. I've seen some really crazy stuff. I have no problem telling you about it, but I have never made a serious mistake on a patient. Because every time I operate, I take my job very seriously. I feel like this is a living human being, and if I make a mistake, they're going to have to live with the consequence of my mistake. Now, that doesn't mean I haven't had a complication before. My worst complication was spinal fluid leak, right? And I tore through the dura. And the problem, honestly, I think it was actually from another surgeon that did, but I got back into that area and retore it open. All right, now spinal fluid leak's pretty well-known complication of spine surgery. And it happened when I was doing a fusion on a patient many years ago. And that patient's wound got infected, and they had a spinal fluid leak with a wound infection. And it's the worst thing you could ever imagine, because you cannot put a drain in, which you need to treat an infection with drain, because you'll just keep draining the spinal fluid. So it was an absolutely horrific problem. The guy never died, he stayed alive, but he was on antibiotics in the hospital for literally 3 months. And draining spinal fluid, and I had to keep checking the wound, taking him back, revising him, putting antibiotic beads in. It was a nightmare. But that was my fault. I created that complication. Now, was that a mistake? No, because I was doing his spine surgery, and some other surgeon that did a microdiscectomy before me cut the dura, got a leak, and it scarred over eventually. But then when I went back in there and was operating, I got into that same leak, all right? And the patient didn't tell me he had it, because he didn't know. I will tell you that I hear this all the time. I find spinal fluid leaks on patients from other surgeons, and I say to the patient, did you know you had a spinal fluid leak from your last surgery? Did the surgeon tell you? And they say no, they never mention anything. Now, why do surgeons not tell the patients? Why do they lie? And because they're afraid. They don't want to get sued. They don't want to get sued. But the truth is, you're not going to get, you can get sued for a spinal fluid leak, but they're not going to win. And the reason is it's a known complication of spine surgery. As long as you've done informed consent properly, you tell the patient you can have a spinal fluid leak, then you've done everything you can do. As long as you're not negligent during the surgery in creating it, which most doctors are not negligent, then you can have a spinal fluid leak complication, and you're not going to lose that lawsuit if they do sue you, okay? Because it's known. It's a known complication. So when I have a spinal fluid leak, if I ever do, which I haven't had one in many years, I just tell the patient, look, I tore the dura. It was all scarred up, and I got into it, and I tore it, and you had a leak, and I fixed it, and you're going to have a little bit of swelling on your incision for the next few weeks, but it'll go away on its own. I just tell them, you know, because they deserve to know, number one, and it's my responsibility to tell them. I'm their doctor. I'm the one who created it. But a lot of doctors are afraid. And how do I know this? Because I've seen these patients. They come to me afterwards, after they've had surgery elsewhere, and they're suffering and hurting, and then I have to fix them, and I do. But I find out, you know, during that time that I'm treating them that, oh, that other doctor had a complication they never told you about. It happens so often. I don't know what to tell you. All right, any more questions?
Yes, this next question comes from...
Before we do that, let's run the video on how does the Deuk laser disc repair actually work. Welcome back. We are now done.
Let's do a sitting on, please. Thank you.
We fixed 2 discs. I'll take the questions because we're going to end the live stream soon. So go ahead.
This next question comes from To Be Continuing on YouTube.
Thanks for joining us. To be continuing.
They ask, hi doctor, is there any way you perform this procedure outside of the U.S.? If yes, what facility do you require?
I can perform the procedure outside the U.S. My staff would love to travel. Which country are we talking about? It would probably be, I don't know, the cheapest I could imagine the surgery outside the United States would be at least $2 million US, because I have to fly all the equipment, I have to rent the facility, I have to get privileges, I have to get a license, I have to travel with my entire team. And to do that, it's very expensive. So I would say minimum $2 million, depends on the country, and then up to perhaps $10 million to do it. So I don't know that it's worth it. I would just come to Florida. It's a lot cheaper. We have one location. We're a small company. We developed this technology in a small company. That's typically what happens, by the way. Big ideas start in small companies. Small companies then get bought by big companies. The big companies see the technology, love it, they buy it. I'm not selling my technology to anybody. This is going to be Deuk Spine Institute's technology forever.
Thank you.
I'm not motivated by money to be bought out. I'd rather preserve the quality of what we do and maintain control. When you sell your ideas and your company, you give up control to a bunch of venture capitalists on Wall Street who don't have any value for quality of care. Next question.
Next question comes from Jenny on YouTube, asking, what makes this surgery so hard?
What makes the surgery so hard? Well, first of all, it's something completely different that no spine surgeon is trained to do. Basically getting into the spine through the neck with a 4mm incision and doing the entire surgery through that incision. That's what makes the surgery. And then using the endoscope. Most spine surgeons don't know how to use an endoscope. And the spinal endoscope is completely different than all of their endoscopes. Other endoscopes have 2 or 3 ports, so the surgeon can work through 2 or 3 cuts. This is a single incision, single port, single channel, and all your instruments have to go in sequentially. And then you're using a laser, which most spine surgeons don't know how to use a laser. I mean, there's so many things. You have to avoid the spinal cord, you have to know your anatomy. It's just a completely unfamiliar for these surgeons. It would be like asking a concert pianist who plays the piano in concert to play a viola, right? I mean, if they've never played a viola or violin in their life, how are they ever going to be good at it? So just because they're a musician doesn't make them able to play another instrument with perfection. And you got to be spot on perfect with this surgery. All right, there's the incision. You guys see that? 4mm?
Yes, we do.
Tiny. We're pretty much done. Any other questions? I'll take them quick while we put the bandage on.
This next question comes from Gina, once more on YouTube, asking, how do you learn how to not hit the spinal cord? What if there was a lot of disc fluid in the spinal cord? Would you still be able to treat it?
If there was a lot of disc fluid. So first of all, the disc doesn't have any fluid. It has the nucleus pulposus, okay? And the nucleus pulposus is a jelly, not a fluid. It's firm. I need that. I need a mastisol, whatever it is. All right, you ready to put it?
Yes, sir.
All right, tell you when. Go ahead. All right, good, that's enough. So, I'm a neurosurgeon, by the way, in case you didn't know. My job is to not hit the spinal cord. That's what I've been trained to do. Now, as a neurosurgeon, we're the only doctors in the world trained not to work around the spinal cord and not hit it, okay? So that's what makes me unique, too, is that I'm a neurosurgeon doing pain management procedures. Because the truth is, you need a surgeon to do the pain management procedure, because it's a surgical procedure. Having a pain management doctor is a very bad idea doing your surgery. But more and more pain management doctors are doing surgery because they're motivated by greed to make the money, the surgeon money. You understand what I'm saying? So surgeons are paid well because they go through extra training and specialized training in surgery. Surgeons get paid well for their procedures, but if you're a pain management doctor doing the same thing a surgeon does, you're going to get paid the same as a surgeon. Because the insurance companies don't discern between a surgeon and a pain management doctor. They just pay for the procedure. So if a pediatrician who's never done surgery in their whole life suddenly goes and does brain surgery, they will be paid the same amount of money. I need a 4x4. Yeah, they'll be paid the same amount of money as a brain surgeon who's done 30 years of brain surgery. Okay, there's no distinction. And the crazy thing about it is that the law allows a pediatrician, wait, be careful, watch the tube please, allows a pediatrician to do brain surgery. You understand what I'm saying? Here, you hold this here, hold this here, and I'll get this off. So if you get a pediatrician to do brain surgery, they will literally get paid the same as a brain surgeon to do the same surgery, because that's how insurance companies pay. They don't care how qualified you are. They don't care about your training or anything, how many procedures you've done. This is so big. Don't we have a smaller? We need a small one.
Yeah, yeah.
Yeah, remember, there's a little bit of an allergy to adhesive, so we want to minimize that. That's perfect. Let me have that. That's perfect, yeah. Thanks. That's the right size, believe it or not. Any other questions? We're going to wrap this up in just a minute, but I'll take another one or two questions.
These
Let go.
These last two questions come from RJ on YouTube. First question they asked, how much time does it take for the disc to completely heal?
1 year, RJ. 1 year. It takes 1 year to completely heal.
And then the last question is, if a patient had degenerative disc disease and spondylosis, is there any concern with stabilization of the spine after the surgery? Cervical spine, I'm referring to.
No, there's no concern because the Deuk laser disc repair, what you just saw, stabilizes the disc. You guys have been lied to, telling you that you need to have a metal put in there to stabilize the disc. It's nonsense. You don't. As a matter of fact, we used to believe that you needed a fusion to stabilize, and then it became an artificial disc. Well, if a fusion was needed to stabilize, now an artificial disc, the artificial disc isn't fusing, is it? No. So then how could you have stability if there's still movement, right? And the answer is quite simple. You don't need movement. You don't need to eliminate movement to have stability. So what do you think, Dr. Patel? We're pretty much done. You can go ahead and end the live stream and show them one of our testimonials.
And good morning, I'm Dr. R. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again. So I did some research, found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4mm incision. And we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great, feel very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need the surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, I mean, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
Yeah?
it's not the case right now.
I think, yeah, well, you could do. Oh,
I
yeah,
have
it's a
some
little overcast right now.
Yeah.
But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right,
Thank you very much.
congratulations. You're
Thanks,
welcome.
Thanks again.